I'm delighted that we're in the Leading Places project. As a university, we are fundamentally committed to partnership and making a difference in cities and in our region.
I think the key thing about the Leading Places project, it enables us to have a more strategic collaboration between the universities in our city, two great universities, and the academics working in those institutions, and ourselves as the local democratic institution in the city. And that's to help us address some of the big societal problems that we face.
People are living to an older age, but more likely to have long-term conditions, and that's putting real pressure on health and social care services.
Changing demographics, anticipated funding cuts to social services make the challenge of better ageing a particularly salient issue for many people in the city. This is a particularly real focus for our own Centre for Innovation and Research in Wellbeing. By working together, we really feel we start to have a real impact on the quality of people's lives here.
Leading Places links to some of our broader strategic ambitions, like those outlined in the local digital roadmap, about how we plan to transform digital services to deliver more joined-up health and social care.
We found it really exciting to see this dynamic group of organisations work across system boundaries to support citizens in staying in their own homes.
What Leading Places will enable us to do is really provide a platform for us to develop these solutions, to work in partnership. It will allow us to bring together the problems of the city, the communities themselves, and academic opportunities to solve them. It will also allow us to work more strongly together and to look outwards, to bring in opportunities, for example, research grants that we wouldn't have been able to do on our own without Leading Places.
When the opportunity came up to get funding from Health Education England, Kent Surrey Sussex, to fund a DOSI Fellow, which is a clinical fellow, to work for a year to support the setup of this testbed, we jumped at the opportunity.
The Leading Places, it was absolutely vital because it gave us this fast-track access to the stakeholders that we needed in order to take forward our vision for our research projects. So it played the role of this base where these three pillars of the Council, NHS Trust and academia are coming together around the same table, and then they can discuss on a variety of different projects to take them forward. One of these projects was our digital health testbed.
So this is the end of Leading Places. It's the final event, but it certainly doesn't feel like that on the shop floor. We're in full throttle. We're planning for the next year, but also beyond. It's a launch pad for something bigger.
Leading Places, as an ongoing strategic partnership, will enable us to collectively use the strengths, resources and skills that we have to ensure the best possible outcomes for people of Brighton and Hove.